but certainly not least, we have Dr. Uzoamaka Nwankpa. Dr. Nwankpa is a community health registered nurse, and I believe it was National Nurses Week last week or recently. Hey. We're celebrating all month. I know. Listen. My aunt is a nurse practitioner, so I have lots of love for the nurses here. Dr. Uzo is a community health registered nurse, an educator, dance facilitator, and research who hails from Enugu, Nigeria. With a strong belief in the healing power of music and dance, she integrates these elements into her work to promote health awareness globally. Dr. Uzo earned her Doctor of Nursing practice degree, focusing on the well-being of healthcare workers, amen, and founded Wellness Promoters LLC and the Uzo Method Project, addressing healthcare disparities. She is collaborating with institutions like the Freedom Community Clinic and Sacred Roots, where she offers culturally inclusive wellness experiences and communal healing sessions for marginalized communities, caregivers, nurses, and healers from communities who have been historically divested from. Amen. Dr. Uzo holds a Bachelor of Science in Nursing, a Master of Science in Nursing with a public health focus, and completed a postmaster's fellowship in maternal and child health research, where she developed the Richer model. She advocates for using indigenous African healing practices as a healing tool for individuals and communities. And I'm really happy to have her here in part because she's really completing the research and the policy and the practice. Yeah. And so she's helping us see what it means to actually create modalities. And then hopefully from a federal perspective, it's like, okay, how do we ensure that we're supporting and funding these modalities as they work? So Dr. Uzo, I don't know if you want to come up here or sit down. Yeah. Take it away.
Thank you so much for that. Hello, everybody. Wambogo jelu nubili nuwe osini hunaya dada o. Wambogo jelu nubili nuwe osini hunaya dada o. Nwanne m ọga na chi m na-akpọ m na mma onyire ahụhụ m aye ihe dị n'ọba aye ihe dị n'ọba daalụnụ. Afọ m bụ Uzoamaka Nwankpa. Abụ m onye Igbo. Ndị kpọpụta m ebe a bụ ndị be anyị, ndị Iwolo Eziagụ. Ana m ekene unu. My name is Uzoamaka Nwankpa. I am the daughter of Uzoamaka and Ebelechup, granddaughter of Mada Abuchi Shidiobu, Nwarashiono, and Wovuako, great-granddaughter of Udu and Ugona, and great-great-granddaughter of Akwudumano, and many, many other names that I do not know, but it's because of them that I am. I'm a proud Igbo woman, immigrant to the United States. My parents still live in Nigeria. I came as a child here at 15. I actually was like, do I say this here? But why not? I came and then I quickly ran out of status. Yeah, so I ended up becoming undocumented and became very vulnerable. I identify as Black. I identify as Pan-African. I identify as an Obanje spirit child. And as Lauren mentioned, a community health nurse. And I chose community health nursing because in nursing school, we focus so much on acute care medicine in the hospital where people are sick. So it's like sick care. But in community, we look at the well population. We look at how to make sure that people don't end up in that place, the hospital. Great work that's done there, by the way. However, most of life belongs in the community. So I'd like to kind of paint a small picture about the framework that we use in community and public health. If you can think of a target, you know the target symbol? There's like a bullseye in the middle, and then a ring around it, and then perhaps a ring outside of that. So we'll just look at these 3 rings. In the middle is the child, the individual / families. Outside of that is the communities in which that child lives and plays and prays, right? So that's the schools, the churches, the neighborhoods, the parks. And then outside of that circle is systems. Dun, dun, dun. That's where our government comes in. And that is where a lot of decisions are made, and that trickles into the child. So no matter what that family does, that family can play, pray, get educated. And if the systems push down policies into that child, no matter what that family does, they would not thrive, okay? So in community and public health, we look at interventions at each of these places in this framework. I think Bronfenbrenner, I'm not sure if I'm saying his name properly, he came up with the human ecology theory, and that's the framework that we use to look at how we're going to bring interventions in. Now, my purpose is to help us all remember our old ways of being, to help us remember before it was colonized out, stolen, just taken away, right? And when I arrived in Arizona after I was done with undergrad, I was so passionate about community and public health nursing. I got the privilege of working with a program called Nurse Family Partnership, and this program introduced me to a group of women who were experiencing postpartum mood disorders. And we decided to create a beautiful space for them where they could come and just receive alternative and complementary services, massage, dance, acupressure, acupuncture, play groups, mama and me, dada and me, those sorts of things. And so I held a space for mothers to dance. And sometimes we'd have one mother, sometimes we'd have 0. And I would be there religiously every week, every Tuesday at 6 p.m. Well, most times, no one showed up. But when we surveyed the mothers, we learned that they just wanted to know that there was a service there, just in case they felt healthy enough to leave their home and come and dance, all right? And so this took me to a different place, to Aotearoa, which is New Zealand. Somehow Americans aren't so excited about this kind of work, but they were very interested in mothers and babies and dancing. And when you mix culture and spirituality and health, they were into that. So I went and visited them and danced with the mothers and babies. And after that, we learned, out of the 4 pillars, I have an additional pillar, which is social well-being that we work with, which brings in that community piece that you were talking about. And we found that out of their physical well-being, out of their emotional well-being, out of their spiritual well-being and social well-being, can you guess which pillar that they felt the most supported in that space? What do you think it was? Yes, it was their social well-being. These women, these mamas were isolated. The depression, the anxiety comes from disconnection. There is something that's happening where we get disconnected, and these old ways somehow reconnect us. The singing, the dancing together, the playing together, the being in nature together, the foraging together, the eating together, the praying together. That is the thing that reconnects us. But somehow that's not being prescribed by our healthcare providers. Why not? Right? And so after I spent time there, I decided to come back here, and I'm still asking the questions, you know? Where in this bullseye target, like how can we provide the intervention at every level, which I'm so excited to be a part of this panel because it feels like this is an example of where it's happening, right? We've got intervention happening through policy. We have interventions happening through faith-based communities, through the schools, right? Through the public parks. It needs to happen not just with the family saying, why aren't you eating healthy? And, you know, like, what is wrong with you and your baby? And why is your child doing these things in school? Well, we have to zoom in, and we also have to zoom out, right? So I'm going to end here so that we can talk more. Questions.